Thanks for staying with us. We're turning our attention now to Africa. And we're beginning with health matters. A countrywide rollout plan is set to deploy 333 devices for diagnosing tuberculosis. The World Health Organization endorsed the platform is expected to help in scaling up testing to combat TB and other infectious diseases. TVC News, Kemi Balogun reports.
The tuberculosis burden in Nigeria is identified mainly by the large numbers of undiagnosed and untreated cases. But recently, the use of technology has proven to be a game changer in the diagnosis and treatment of infectious and even non-infectious diseases globally, like TB. The TrueNat device is one of those technologies that will be deployed across all states in Nigeria and are expected to enhance TB and drug-resistant TB diagnostics in isolated facilities in the country.
The company looked at it and structured this machine to actually adapt into our system, where you can run it for 8 hours when it's fully charged. And it's not temperature dependent. It can stay as much as 40 degrees in an environment.
When people with TB come to a center doing microscopy, half of them don't get diagnosed. And these people, when they go back to the community, are the ones that they keep giving TB to other people. So in spite of microscopy being used routinely for a long time,
a minimum of 8,000 more people are expected to now be tested daily, culminating in testing 2 million more people each year, which will further reduce the risk of community transmission while ensuring timely care.
The advantage is, one, is also going to help us to make sure that people don't spend more to go to where the other equipments are. Two, is going to also help us to increase our catch and also our case finding along the not just TB alone, but also for the drug-resistant TB pattern.
What we have now has what they call a solar power station attached to it. So what it means is that the current equipment we have deployed in Nigeria are going to be independent of power, so we don't have power issues, coming up as reasons for not being able to meet, the expectations of the funding partners.
Experts here say with Nigeria gearing up to reach the 2035 target of ending TB, improving techniques of diagnosis and treatment like this is a milestone achievement. Kemi Balogun, TVC News, Abuja.
Now, for more on curbing tuberculosis, founder Law for Health Organization, Dr. Yusuf Haroun, joins me on the news via Zoom from Lagos. Good to have you join us.
Thank you very much. It's a pleasure.
So I want to start by discussing two statistics with you. One of them is that we have the highest burden, or one of the highest burden in the world. And then surprisingly or shockingly, the burden isn't reducing, it's actually increasing. I just want to take that statistics just to be accurate. In 2017, we had about 424,000 people living with tuberculosis. Now we have about 479,000 tuberculosis cases in the country. What is responsible for that increase?
One of the main factors for this increase in the prevalence of tuberculosis in our country and in the world was the introduction of COVID-19. Tuberculosis manifests and increases where there is a suppression in immunity and when there is a comorbidity. A good example of this comorbidity is COVID-19. If we look at the statistics which you talked about, in 2022, we had a total death from tuberculosis of 1.32 million. That was when COVID-19 was global. It was all over the world. It was a pandemic. There was a lockdown. And that was why tuberculosis also was high. Mainly people with tuberculosis are people with low immunity or immunosuppression. Another example is acquired immunodeficiency syndrome, which is what? Which is the end stage of HIV, human immunodeficiency virus. So patients with HIV have a higher tendency of developing what? Tuberculosis or TB. Children also have a higher tendency of developing tuberculosis, unlike adults. All this and what you said between 2017 and 2023 is because in 2023, there was a global pandemic of COVID-19. There was more rates of what? Of HIV/AIDS. So all these comorbidities also lead. Now also, I want to add that Nigeria is not the highest rate of country with tuberculosis. Surprisingly, a developed country in the world is the highest, and that is China. India, China, Bangladesh, all these countries in total have a higher rate. Nigeria is also one of the leading countries with tuberculosis in Africa. But in the whole world, China is still the leading country. And why are these countries the leading? Number one, density in population. All these countries I mentioned, they have a high density of overpopulation. China, India is now the leading country in world population, having over billions of people there. China is inclusive. Nigeria is also highly populated. So
and Dr. Haroun, as you mentioned, it just then occurs to me that population, is also plays a role in terms of transmission. And we understand that one person can transmit the disease to about 15 people in a year. So which is one missed case, actually. How then should we improve case detection, especially amongst children and younger persons, just to reduce that transmission rate?
The first thing you have to do is education. People need to be educated about this condition, tuberculosis. Reduce crowding. Overcrowding also causes tuberculosis or increases the risk or the rate of tuberculosis, TB. There is a particular bacteria which is responsible. It is called Mycobacterium tuberculosis. This organism can be infective through airborne, even through communication, coughing, spitting, saliva. All these things can infect another person. And when many people are in a closed room or closed space, there's a higher tendency of them to infect one another with it. Also, one thing people should know is if you see somebody with some telltale signs of tuberculosis, please try to report to the nearest health facility, take the person to see a respiratory medical doctor or a practicing physician so that the person can be treated. What are the signs you know for these cases? Number one, if somebody is having persistent cough of more than 3 weeks. Number two, if the cough is productive of blood, which we call medically hemoptysis. Number three, if you see a patient or you see a friend of yours or a neighbor or colleague who is losing weight consistently, and the person is also having anorexia. Anorexia means loss of appetite, and the person is sweating heavily at night, even in the presence of air condition. The person is sweating. So these are some of the telltale signs of tuberculosis in which you can even suspect. As an individual, you can suspect, but a medical doctor will confirm the diagnosis that this is tuberculosis. So if you see all these conditions in somebody, you must suspect tuberculosis. And how can we address it? There's something which we call prevention, which is better than cure. So we have a particular vaccine or immunization scheme, which every child should get. The first one at birth is BCG, called Bacillus guarin. The BCG is given at birth. And some schools of thought claim that this particular vaccine can provide lifelong immunity to an individual as long as there is no immunosuppression or comorbidity.
Dr. Haroun,
like COVID-19.
I know that you're making, apologies, I know you're making a very important point, but as we speak, it just occurs to me that, coughing again is one of the symptoms of tuberculosis. But for a lot of people, once they're coughing, the first thing they do is to go to the hospital or probably just buy drugs and treat malaria. How do we improve community sensitization, in terms of, if we want to reduce the burden of tuberculosis?
The major standard in community health is failure of prevention of diseases is what causes this prevalence in tuberculosis, and also primary care. So it's not everybody that coughs that is diagnosed of having tuberculosis. Before you can diagnose tuberculosis clinically, this cough must be more than 3 weeks. This cough must be productive of blood. When the person coughs, you see blood in the sputum. This person is going to be having night sweat. The person is sweating, drenched, just like the person took a bath. The person is wet all over the body, sweating. The person is also losing weight. The person is having loss of appetite. The person is weak. These are some of the pathognomonic features of tuberculosis. Then also when you do an X-ray, you are also going to see in the X-ray pleural effusion. You are going to see conditions that are suggestive of tuberculosis. Then you can also take a sputum test of this person. So when the person goes to hospital, as you said, the doctor is going to write a test called sputum AFB, sputum acid fast bacilli. the person is also going to do a test called mantle test on the skin, mantle skin test. So these are some of the features in which you will confirm the diagnosis that this particular individual or patient has tuberculosis.
All right, we're looking to cut down or totally just eradicate the epidemic by 2030. And we'll see how Nigeria does this. Thank you so much for your time. Always a pleasure to have you on. Founder, Law for Health Organization, Dr. Yusuf Haroun.
Thank you very much.